Hey gentlemen, welcome back to Dental Miracle. By 2030, you might never need dental implants again. 5 countries are in a fierce race to make history, and the winner could change dentistry forever. Today we're diving into the most exciting competition in medical research, the race to regrow human teeth. Imagine losing a tooth, and instead of getting an implant that costs thousands of dollars, you simply regrow it naturally, like you did when you were a kid. That future is closer than you think, and 5 nations are battling to get there first. Let's meet the competitors. In Lane 1, we have the current gold medal favorite, Japan. Leading the charge is Dr. Katsu Takahashi from Kyoto University. And his team isn't just talking about tooth regeneration, they're actually doing it. Their secret weapon, a drug called TRGO35. This isn't science fiction. This is happening right now. Here's how it works. Inside your jaw, you have dormant tooth buds, leftover genetic code from when you grew your baby teeth and adult teeth. These buds are suppressed by a protein called UZAG-1. Think of UZAG-1 as a lock on a door, and behind that door are your third set of teeth waiting to grow. TRGO35 is the key. It's a UZAG-1 inhibitor, meaning it blocks that blocking protein. When you inject TRGO35 into the gum tissue, it unlocks those dormant tooth buds and tells your body, hey, it's time to grow another tooth, and it works. In animal trials, they've successfully grown teeth in ferrets, mice, and dogs, not fake teeth, real, living teeth with roots, nerves, and enamel. Current status? Phase 1 human trials wrapped up in 2024 with no major safety concerns. Phase 2 trials are underway right now in 2025, testing the drug on adults with congenital tooth agenesis, people born missing teeth. If everything goes according to plan, Phase 3 trials will begin in 2027, and by 2030, this drug could be available in Japanese dental clinics. Japan's advantages furthest along in human trials, government backing and funding. Proven results in multiple animal species, clear regulatory pathway. Japan's challenges, high cost expected initially. Limited to people with existing tooth buds, requires precise injection technique. Japan is in the lead, but they're not alone. Let's see who's chasing them. Next up, South Korea, with a completely different approach. While Japan is using injections, South Korea is developing a dissolvable microneedle patch. Think of it like a nicotine patch, but for your gums, and instead of delivering nicotine, it delivers tooth regenerating compounds. This technology comes from researchers at Seoul National University and several biotech startups that have been quietly working on this for years. How it works? The patch contains hundreds of microscopic needles, so small you can't even feel them, loaded with a cocktail of growth factors, including BMP2, BMP7, and WNT signaling molecules. You stick the patch on your gum where the missing tooth should be, and over 6 to 8 hours, these needles dissolve and release the growth factors directly into the tissue. These signals tell your stem cells to differentiate into tooth-forming cells. Current status, South Korea, is in the preclinical phase. They've shown promising results in animal models, especially with regenerating tooth enamel and dentin. But they haven't started human trials yet. South Korea's advantages: non-invasive, pain-free application, could be cheaper to manufacture than injections, easier for patients to use at home, targets multiple growth pathways simultaneously. South Korea's challenges still years behind Japan in testing. Uncertainty about whether patches can deliver enough compound to trigger full tooth growth. May only work for partial regeneration. Not full teeth, South Korea has the most patient-friendly delivery system, but can they catch up to Japan before 2030? Time will tell. Don't count out the United Kingdom. They're taking a pharmaceutical approach that could surprise everyone. The key player here is a drug called Tideglusep, originally developed to treat Alzheimer's disease. But researchers at King's College London discovered something unexpected. It also stimulates tooth repair. How it works? Tideglusep works by inhibiting an enzyme called GSK-3. When you block GSK-3, you activate the WNT signaling pathway, the same pathway that tells stem cells to become tooth cells during childhood. But here's the twist. Tideglusep doesn't regrow entire teeth. Instead, it stimulates your existing tooth to repair itself from the inside out. When you have a cavity, your tooth tries to heal by producing dentine, but usually it can't produce enough. Tide glue seb supercharges this natural process. Apply it to a cavity, and your tooth starts filling the hole with new dentine naturally. Mice treated with Tide glue seb-soaked sponges in their cavities showed complete cavity repair within 4 to 6 weeks. They filed patents in 2017 and have been seeking funding for human trials. The COVID-19 pandemic slowed progress, but there's renewed interest as of 2025. UK's advantages: drug already tested in humans for Alzheimer's, so safety profile is known. Could be available faster than new drugs. Treats cavities without drilling. Lower regulatory hurdles. UK's challenges: only repairs existing teeth, doesn't grow new ones. Requires the tooth structure to still be present. Limited commercial backing compared to Japan. The UK might not win the race to regrow full teeth, but they could win the race to end cavities forever. And that's still a massive victory. Now, let's talk about the United States. With 2 major research centers in the game, America is coming in with big funding and big ambitions. Tufts University. At Tufts, researchers are using stem cell therapy combined with 3D scaffolding. They're essentially building a tooth from scratch using your own stem cells. Here's how it works. They extract stem cells from your dental pulp or bone marrow, culture them in a lab, and then seed them onto a biodegradable scaffold shaped like a tooth. This tooth seed is then implanted into your jaw, where it matures into a fully functional tooth over several months. In 2023, they successfully grew rat molars using this technique. The teeth had proper enamel, dentin, and even connected to surrounding bone tissue. The University of Washington, meanwhile, at the University of Washington, they're taking a genetic approach. They're using CRISPR gene editing to activate the genes responsible for tooth developments. Specifically, the genes that are turned off after your adult teeth come in. Their goal is to inject a CRISPR treatment directly into the jaw that switches on these dormant genes, triggering your body to naturally grow a third set of teeth without needing external growth factors. Current status: both teams are still in early animal testing. Tufts is closer to human trials, possibly within 2 to 3 years. The University of Washington's CRISPR approach is more experimental and likely 5 to 7 years away from human testing. USA's advantages: massive research funding from NIH and private investors. Multiple approaches increase odds of success. Advanced biotech infrastructure, strong patent protection. USA's challenges: fragmented research, multiple teams competing rather than collaborating. Strict FDA approval process could slow deployment. High commercial focus means expensive treatments initially, starting later than Japan. The US has the resources to win, but they're playing catch-up. Can American innovation overcome the time gap? And finally, we have China, the wild card that could change everything. China is investing heavily in regenerative medicine, and several universities are working on tooth regeneration, including Capital Medical University in Beijing and Sun Yat-sen University in Guangzhou. Their approach: Chinese researchers are exploring stem cell injections combined with biomaterial scaffold, similar to the US approach, but with faster development timelines. In 2024, a team at Capital Medical University announced they successfully grew tooth-like structures in pigs using a combination of dental stem cells and a collagen-based scaffold. Current status: China's advantage is speed. Their regulatory environment allows for faster testing. And they've announced plans to begin human trials in 2026, potentially catching up to Japan. China's advantages: rapid development timelines, huge patient population for trials, government commitment to becoming a biotech leader. Lower costs could make treatment more accessible globally. China's challenges: less transparency in research results. Questions about long-term safety data. International patents could limit global deployment. Quality control concerns. China could be the surprise winner if they can prove their treatments are both safe and effective. But the world is watching closely. So, who will win the race to regrow human teeth? Here's my prediction. First place, Japan 2030. Japan will likely be first to market with TRGO35. They have the most advanced clinical data, government support, and a clear path to approval. If you want to regrow a missing tooth, Japan will probably be your destination by 2030. Second place, South Korea, 2032 to 2033. South Korea's patch technology will arrive a few years later, but it could become the preferred method because it's non-invasive and easier to use. Third place, United Kingdom. 2031, the UK's Tiglucid could actually hit the market around the same time as Japan, but for cavity repair rather than full tooth regeneration. This might seem like a smaller achievement, but it could help billions of people worldwide. Fourth place, United States, 2033 to 2035. America's diverse approaches will eventually pay off, likely with the most advanced and expensive treatments. Expect premium regenerative dentistry clinics in major U.S. cities by the mid-2030s. Wildcard China, 2028 to 2030 or later, China could shock everyone by reaching human trials quickly and potentially beating everyone to market in Asia. Or they might struggle with international acceptance. It's truly unpredictable. The race to regrow human teeth is one of the most exciting competitions in modern medicine. Within the next decade, tooth loss could become as treatable as a broken bone. Whoever wins this race, we all win. Because the real prize isn't national pride, it's millions of people getting their smiles back. Which country are you rooting for? And more importantly, would you be willing to try tooth regeneration therapy when it becomes available? Let me know in the comments below. If you found this video helpful, please give it a thumbs up and subscribe to Dental Miracle for more cutting-edge dental science content. We're tracking this race closely and will keep you updated as new developments emerge. Thanks for watching, guys, and I'll see you in the next video.